Okay, so let's move on to some therapeutic procedures. But before then, I'm going to spend some time on this slide. There's not much on this slide, it just says arthroplasty and amputation. But I'm going to do the questions at the end of chapter 667 and just talk about some reasons why. Okay, so number one, a nurse is completing preoperative teaching for a client who is to undergo arthroplasty or arthroscopy, sorry. Which of the following statements should the nurse include? Avoid damage or moisture to the cast. That's incorrect because there's no cast. An arthroscopy is looking into a joint. There's no cast. Inspect your incision daily for indications of infection. Absolutely. After an arthroscopy, there's a risk of getting septic arthritis. So definitely checking the wound to make sure it's not red, swollen, and tender. Apply ice packs to the area for the first 24 hours? Sure. Because of you've had manipulation of a joint, you've had a camera go into the joint, maybe some parts of the joint have been cut out, such as meniscus. So sure, ice packs are totally reasonable for the first day. Keep your arm in a dependent position. So a dependent position just means hanging down, no elevation at all. That's not really correct, right? So when we're talking about rest, ice, compression, elevation, dependent position means you're not elevating it at all. Okay. Perform isometric exercises. Yes, right. So after a arthroscopy, the joint's going to get stiff if you don't move it as advised by the team that did the arthroscopy. So you're going to be given advice in terms of range of motion exercises. Okay, so the answer should be B, C, and E. Okay. Number two, nurse is planning care for a client who is post-operative following an arthroscopy of the knee. Which of the following actions should the nurse take? So assess color and temperature of the extremity. Absolutely. Okay. Remember, if you have any procedure to a part of the limb, you should assess the whole limb, so all the way to the toes or all the way down to the hand for color, which is basically telling you blood supply, and also temperature, which is also telling you blood supply. If you have poor blood supply, you're going to have a pale looking limb and you're going to have cold limb. Okay, so A is correct. B, apply warm compresses to the incision site. No, that's not true. You would typically apply cold compresses. C, place pillows under the extremity. Sure, you could elevate the leg to allow some drainage, so elevation is true. Administer analgesic medication, yes. Sometimes after an arthroscopy, there's pain. And assess pulse and sensation of the foot. Absolutely. So A and E are kind of saying the same thing, right? Assess pulse and sensation. So pulse, the blood supply, sensation, the nerve supply. Okay, so the answer should be A, C, D, and E. Number three, a nurse is assessing a client who is going to have a bone scan. Which of the following statements should the nurse include? Okay, you'll receive an injection of a radioactive isotope when the scanning procedure begins. Okay. You will receive an injection of a radioisotope 2 to 3 hours before the scan begins. Okay, because then you go away for a while and let it circulate through your bloodstream. Okay. You will be inside a tube-like structure during the procedure. No. That's sounding like an MRI. Okay. You're just having x-rays done after you come back from having received the injection. So that's not true. C, you will need to take radioactive precautions with your urine 24 hours after the procedure. No, that's not true. It's not needed after this procedure. It can be for other procedures where you receive radioactive medications, but for this one, not required at all. Okay. you will have to urinate just before the procedure. That's true, just to empty the bladder so that those pelvic bones can be seen with the bone scan. So the answer is D. Okay. Number 4, nurses educating clients at a health fair about a DEXA scan, so bone density scan. So I already know this has to be for osteoporosis. Which of the following information should the nurse include? Okay. A, the test requires the use of contrast material. No. Requires no contrast material, no injection. The hip and spine are the usual areas the device scans. True. That's where they look at the density. The scan detects osteoarthritis. That's not true. The scan detects osteoporosis and thinning of the bones. D, bone pain can indicate a need for a scan. Absolutely. Bone pain is one of the reasons why we do a bone scan, to see if anything lights up in the area of the pain. And E, females should have a baseline scan during their 40s. Yeah, a baseline bone density scan in your 40s gives you a reading of your bone health and how dense your bones are prior to menopause in women. So it's a good idea to have one. Okay, so the answer there should be B, D, and E. A nurse is planning, so number 5, a nurse is planning for a client who will undergo an EMG. Which of the following actions should the nurse include? Okay. Assess for bruising. Who will undergo an action? Which of the following actions should the nurse include? Assess for bruising. Okay, so that can happen after you've been punctured with these needles, so sure. But it says who will undergo an EMG, so that's a bit confusing. Okay, A is a possible answer. Administer aspirin prior to the procedure. No, aspirin's a blood thinner, and you're going to puncture through the skin, so you wouldn't use aspirin. Determine whether the client takes a muscle relaxant. Good idea. If it's a muscle relaxant that someone's taken, it's going to affect muscle contractions, so it's going to affect the testing. Patients would be told usually, do not take anticoagulants, don't take aspirin, don't take muscle relaxants prior to this procedure. Instruct the client to flex muscles during needle insertion. Sure, because when you're contracting the muscle, there's going to be information that'll be provided through the electrode back to the computer. Okay, so that's true. Expect swelling, redness, and tenderness at the insertion sites? Definitely not. That would be a sign of potential infection developing, so you shouldn't expect that. So, I mean, I guess A is the answer. I don't really like it because those assess for bruising, that would be before, or sorry, after the needle's inserted, but sure. C is correct, and D is correct. Okay, good, we'll move on here. Okay, so let's talk about arthroplasty, which to me is really just a fancy term for joint replacement, or say a partial joint replacement. Okay, so surgical removal of a diseased joint. By far the most common reason would be the wear and tear arthritis, so osteoarthritis. Now, that's not to say that patients with, say, rheumatoid arthritis don't undergo joint replacements, because they certainly do. They have joint destruction. But the much more common one is osteoarthritis. Okay, it's just a more common arthritis as we get older. Which joints are typically replaced most commonly? Knee and hip. Okay, so it would be knee, hip, knee, hip, knee, hip, maybe an elbow, or maybe a shoulder. Knee, hip, knee, hip. Okay, so frequently it's those weight-bearing joints of the knee and the hip. Okay. Total joint arthroplasty means that all the components of a joint have been replaced. Okay. So if we're talking about a total knee arthroplasty, so a total knee replacement, we call it TKR, total knee replacement. That's the replacement of the distal femur. So on the top right there, distal femur, the tibial plate, so the top of the tibia has been replaced, and also the patella. Okay. So what about a total hip arthroplasty? Well, that's going to be a replacement of the femoral head. So you can see the ball on the lower right there. So the ball of the upper hip, and then the shaft of the replacement, or sorry, so the femoral head gets replaced, of course, and then the femoral neck and stem goes into the patient's upper femur shaft. Okay, so it's glued in to the upper femoral shaft. Now, with total hip replacement or arthroplasty, the acetabulum, the cup, is also replaced. Okay, so it's not just a new ball. It's the cup that's replaced too with the total hip arthroplasty. Okay. A unicondylar knee replacement is just when one side has osteoarthritis, say, and they replace just one side of the joint, not the whole joint. Okay, so that would be unicondylar, because in actual fact, your knee joint has a lateral part of it and a medial part of it in your knee joint. So if just one part is diseased, say the medial side, the inner side, well, they can do a unicondylar knee replacement. Okay. A hemiarthroplasty is typically referring to the hip where they've left the acetabulum intact, so they haven't put a new cup in, and they've replaced the femoral head, so a new head to the hip, and you get the femoral neck and stem. Okay, so that's a hemiarthroplasty. Okay, so you can see in the image here on the left side, there's been a total hip replacement. So you can see the acetabulum, which is the cup, and then the femoral head is within the acetabulum. Okay. So what are indications? Well, typically people with severe osteoarthritis or severe joint destruction from rheumatoid arthritis, they have a lot of pain, right? They can't go for walks anymore. They certainly can't go for runs. They have difficulty with stairs. They wake up with morning pain. So it's just to improve the quality of life and mobility, right? So osteoarthritis would definitely be the most common reason for getting a hip or knee replacement. Okay. What are the complications? Well, definitely you could get a hip dislocation. So where the ball of the joint, where the ball pops out of the acetabulum, that can occur for sure. And that needs to be put back in rather urgently. Okay. And it's not an easy procedure sometimes to put a prosthetic hip replacement back into the acetabulum when it's been displaced, sometimes, or dislocated, sorry. Sometimes they have to go to the operating room for that. Infection. So any joint replacement, whether it's your hip, your knee, anywhere in the body, always have to think if someone comes in with fever, a red joint, a swollen joint, have to think of an infection. That is really serious. Okay, so an infected joint needs immediate attention with IV antibiotics, and often it needs to have a surgical washout, meaning they go into the joint and wash out the joint. Now with arthroplasty, with total hip replacements or total knee replacements, they often have to actually remove all the hardware. So all the surgery they did before has to come out because it's infected. And there's very poor blood supply to joints to begin with. And if it's an artificial joint, such as an arthroplasty, there's even less blood supply. So all that has to be removed. So it's a really big deal if someone gets an infection. Okay. Anemia can occur post-operatively. Why? Well, during the procedure, there's some blood loss, right? And some people will lose more blood than others. Neurovascular compromise. So you can imagine that the original hip is being cut out with a saw or a blade, and they're inserting the new replacement, the acetabulum and the metal femoral head and shaft. So there's nerves around there that go down the leg. There's blood vessels around there that go down the leg. So we do neurovascular checks of the foot, right? Does the foot have pulses? Is it nice and warm? Does it have good normal capillary refill? Okay, what about the nerves? Can they feel me touching their toes normally? Can they move the foot normally? So are the muscles working? Because the nerves innervate the muscles, right? So neurovascular checks. And then, of course, after a replaced joint, DVTs. Okay, so whether it's the knee or the hip, there's a risk because of some immobility post-operatively, and also you're immobile because of the pain after the surgery, right? At risk for DVTs, deep vein thrombosis, right? So what do we do as prophylaxis for DVTs? So sometimes we'll administer medications to prevent a DVT post-operatively, such as heparin subcutaneously, or another type of heparin called low molecular weight heparin, such as enoxaparin, to prevent a DVT after surgery. Okay, so what else can we do on top of pharmaceuticals such as heparin subcutaneously, enoxaparin that can thin the blood a bit? Well, we can provide anti-embolic stockings. We can give. There's actually machines that provide sequential compression of the leg to keep the blood moving to prevent a DVT. Encouraging the patient to move to dorsiflex and plantar flex the foot, just moving the ankle up and down and up and down. That helps with flow of blood and prevents a DVT. Okay, and of course early ambulation, getting them up with physiotherapy and occupational therapy will definitely prevent a DVT from forming because the blood is starting to move with mobility. What about considerations before the procedure? Okay, so pre-procedural arthroplasty. So whether it's your knee or your hip, those are the most common for sure, for joints to be replaced. Any active infection. So if you have any kind of active infection, whether it's you have a cough or you've been diagnosed with a chest cold or pneumonia or a bladder infection, or that's not going to be very popular at the time of surgery, right? So they're going to hold off if someone has an infection because they definitely don't want this arthroplasty procedure to get infected or to get seeded with bacteria if someone has an infection. Okay. If there's arterial impairment to the extremity, so if someone has a significant blockage of an artery going to their leg, doing a procedure that's going to require a lot of healing, well, that would be a contraindication until they can assess the blood flow to the leg and to see if they can do anything about it, right? So blood supply is really important to a limb when there's procedures being done to it. Now, the first one I didn't mention, but I think I will, certain comorbidities. Well, definitely if someone has significant heart disease or significant COPD in their lungs, or poorly controlled hypertension, or their diabetes is terribly controlled right now. Well, those have to be taken care of prior to the surgery. Okay. Otherwise, the surgery is going to magnify those conditions, and patients can develop, they can aggravate their heart disease, they can make COPD much worse because they've just undergone a procedure. Okay. Okay, so the bottom left there, post-procedure care, that's pretty, I'm not going to spend too much time on that. Typically patients who've had a hip or a knee replacement, they're definitely going to need some pain control afterwards, so taking medications. They're going to need physiotherapy for weeks after to increase range of motion of the new joint. Monitoring for any signs of infection of the area, because as I mentioned, a septic joint is a really serious condition. Regular dressing changes is of course important, and monitoring for a DVT, so red, swollen, painful leg, typically on the side where the surgery's been done, but not necessarily. It could be on the other leg where it's become red, swollen, and tender. Monitoring for symptoms of a PE, so a piece of the clot has broken off of the DVT and traveled to the lungs. So sudden onset of shortness of breath, sudden onset of pleuritic chest pain, sudden onset of abnormal vital signs associated with chest pain and shortness of breath after a surgery would be a concern for a pulmonary embolus. Okay, and of course monitoring for bleeding at the site. Okay. What about some tests that are typically done prior to surgery? So these are routine tests, so a CBC, a urinalysis, electrolytes, kidney function tests, chest x-ray, and ECG. Remember, typically these patients are elderly in general because they're the ones who get osteoarthritis and joint destruction. So these are all screening tests to make sure that they don't have any abnormalities on their chest x-ray or their ECG, for example, or they're not anemic on their CBC. Older patients can sometimes surprise us with an underlying condition that hasn't been diagnosed yet. Okay. Under patient indications, so autologous blood donation. So some patients with surgical procedures can donate blood to themselves months before the procedure, and if required during the procedure, they can use their own blood. Okay. Infection risks, well, these are just ways of preventing infection. And taking normal medications with a sip of water, that's usually done the morning of, unless it's a medication that's going to interfere with the surgery, such as powerful anticoagulants or aspirin products, things like that where they don't want excessive bleeding at the time of surgery. Okay, so I'm not going to spend too much time on this slide at all. Some post-procedural considerations for knee and hip. I think these are covered really well in the book as well. So just in the interest of time, I'm going to move on from this slide. Okay, so let's look at these questions at the end of the chapter, and I think this is chapter 68. Let me just double check that. Yes, 68. So let's look at the question, and we'll just go through it together. If you want to skip forward, no problem. A nurse is reviewing the health record of a client who is to undergo total joint arthroplasty. Okay, so a total joint replacement. The nurse should recognize which of the following findings is a contraindication for this procedure. So age, no, never. We have 90-year-olds, 95-year-olds getting hip replacements. History of cancer, that's not a total contraindication Because remember, if you fracture your hip and you have a history of cancer, well, you can't walk if you have a fractured hip. So you have to have it repaired in order to walk again, right? So a history of cancer is not going to preclude you from having a hip or knee replacement. Previous joint replacement, absolutely not. People have multiple joint replacements over time, so that's not a contraindication. Bronchitis 2 weeks ago, well, if someone has a chest cold and there's a potential for an infection, um, they're not going to be keen to do a joint replacement because of the risk of infection. Okay, so it's going to be D. Number 2, nurse is admitting a client to the orthopedic unit following a total knee arthroplasty. Which of the following actions by the nurse are appropriate? Check continuous passive motion device settings. Yeah, that would be a good idea following a total knee arthroplasty or total knee replacement. B, palpate dorsal pedal pulses for sure. So palpating the pulses at the ankle. That's the posterior tibial artery, and on top of the foot is the dorsalis pedis artery. Okay, so we definitely palpate that. Place a pillow behind the knee. If you place a pillow behind the knee is actually flexed, and a flexed knee is not a great position for a knee because the ligaments are in a more relaxed position and they have the ability to get stiff. Okay, they're not in a stretched position like they are when the knee is extended. Okay, so placing a pillow underneath the knee is not a great idea because of the flexion and causing a stiff knee. Elevate heels off bed. Well, in order to prevent an ulcer from occurring at the heel, elevating the heels off the bed is a good idea. Apply heat therapy to incision? No, no, that's not necessary. In fact, often we'll apply cold. Okay, so the answer would be A, B, and D. Number 3, a nurse is planning discharge teaching for a client who had a total hip arthroplasty. Which of the following should the nurse include in the teaching? Okay, total hip arthroplasty, planning discharge teaching. Okay, clean the incision daily with soap and water. Okay, that's reasonable, just to keep it clean and reduce any chance of infection. Okay, turn the toes inward when sitting or lying. Okay, I don't think that's necessary. I don't really understand what that's asking. The client should externally rotate toes to prevent dislocation. Do they mean externally rotate the foot? Turn the toes inward when sitting or lying. Okay, I wouldn't choose that one because it doesn't make any sense to me. I think they're talking about the foot as opposed to the toes. Sit in a position, sit in a straight-backed armchair. Yes, that's a good idea. So straight-backed armchair keeps the hip at 90 degrees, and that's going to prevent a dislocation. Right? Bend at the waist when putting on socks. Well, bending at the waist. Bending at the waist. Let me just look at the answer here. The hip in a position greater than 90 degrees, which can cause dislocation. Okay. Use a raised toilet, sure. Using it decreases the chance of bending greater than 90 degrees. Yeah, okay, so that's reasonable. Okay. Not a big fan of that question. Okay, number 4. A nurse is assessing a client who is scheduled to undergo right knee arthroplasty. Okay. The nurse should expect which of the following findings? Skin reddened over the joint. I certainly hope not, because that would cancel the surgery if they thought it was infection. Pain when weight bearing. Absolutely, right? Because it's probably for osteoarthritis, so they're going to have pain with weight bearing. Joint crepitus is the crunching sound of an osteoarthritic knee or a damaged knee, so sure. Swelling of the affected knee, absolutely. So joint degeneration often leads to joint swelling, and limited range of motion of the knee or the joint for sure. So those are all signs of joint damage, um, and the joint replacement is hopefully going to address all of those. Okay, so it's B, C, D, and E. Nurse is completing a preoperative teaching plan for a client who is scheduled to have a total hip arthroplasty. Which of the following should the nurse include in the teaching plan? Encourage complete autologous blood transfusion. Sure, yeah, that's a good idea. To have your own blood supply on hand for the surgery. Sit in a low reclining chair. So preoperative, no, that's going to make it very difficult to get up, right? So preoperative teaching plan, who's scheduled, and also not only that, after the surgery, that increases the risk of dislocating the knee, the hip. Okay. Instruct the client to roll onto the operative hip. No, that's going to cause pain, and it could potentially dislocate the hip. Use an abductor pillow when turning the client. So an abductor device is basically used to open up the leg a bit, and that's going to also prevent dislocation. Okay. Perform isometric exercises. Yes. So isometric exercises to increase or to maintain muscle strength, increase range of motion of the joint, and also prevent DVTs. Okay. All right. Sorry, but number 3, can't help you that much because I didn't really like the question. Turning the toes inwards didn't make no sense to me.